Chapter 15 is covering the disaster situations. The United Nations International Strategy for Disaster Reduction defines disaster as serious disruption of the functioning of a community or a society involving widespread human, material, economic, or environmental losses and impacts which exceeds the ability of the affected community or society to cope with using its own resources. While the American College of Emergency Room Physicians, ESERP, states a medical disaster occurs when the destructive effects of natural or man-made forces overwhelm the ability of a given area or community to meet the demand for healthcare. Although there are many definitions for disasters, there are three common factors. First, there is an event or phenomenon which impacts a population or an environment. Second, a vulnerable condition or characteristic allows the event to have a more serious impact. For example, a hurricane will cause much greater damage to life and structures if it directly strikes an area with poorly constructed dwellings compared to striking a community of well-built homes with greater structural support. Identifying these factors has practical implications for communities' preparedness and provides a basis for prevention. Third, local resources are often inadequate to cope with the problems created by the phenomenon or event. We will leave it to the legal minds to determine if the corona pandemic is a national disaster or a national emergency. Apparently, disasters get more aid. Please take a moment to stop this presentation in order to review the objectives for this presentation. So, a disaster can be defined as an emergency of such severity and magnitude that the resultant combination of death, injuries, illness, and property damage cannot be effectively managed with routine procedures or resources. These events can be caused by nature, equipment malfunction, human error, or biological hazards and disease. Natural and human-caused disasters affect thousands of people each year. Major adverse events such as this have the potential to cause catastrophic loss of life and physical destruction. They are often unexpected and can leave whole communities in shock. People who live through a disaster can experience emotional distress. Feelings of anxiety, constant worrying, trouble sleeping, and other depression-like symptoms are common responses to disasters before, during, and after the event. Many people are able to bounce back from disasters with help from family and the community, but others may need additional support to cope and move forward on the path of recovery. Actually, anyone can be at risk, including survivors living in the impacted areas and first responders and recovery workers. Disasters can be divided into two basic groups, natural and man-made. Among the natural disasters, we can count earthquakes, volcanoes, eruptions, hurricanes, floods, and fires. Among the man-made disasters will include war, pollution, nuclear explosions, fires, hazardous materials exposures, explosions, acts of terrorism, and transportation accidents. Human disasters are those that are the result of unintentional or intentional causes. An example of an unintentional human disaster is an explosion that occurs within a mine or a fertilizer plant, industrial accident, or during the transport of incendiary materials. An intentional human disaster is often the result of acts of terrorism by people whose objective is to manipulate the politics and policies of a country by frightening and aiming at the civilian population. Intentional disasters generally involve types of bombs, biologics, and chemicals. Terrorists use a variety of methods to achieve their aim, and bombs are devices designed to explode on impact or when detonated to kill people, damage, or destroy property. They are the most common form of terrorist attacks in the United States. Explosive injuries can include blunt and shockwave-induced trauma, as well as burns, hearing loss, and injuries from shrapnel and secondary collapse of structures. A dirty bomb will combine radioactive material with conventional explosives. When detonated, it scatters radiation as well. Although it generally does not cause mass casualties, it can cause fire, radiation poisoning, fear among those who were exposed, and costly decontamination of locations in the immediate environment. When a dirty bomb is released, responders will focus their attention on caring for injured victims and those referred to as the worried well, unaffected people who believe they are at risk for physical consequences. As of 2014, there have been more than 100 serious nuclear accidents and incidents from the use of nuclear power. Some of the most well-known are 3 Mile Island, Chernobyl, and Fukushima. However, the likelihood of a nuclear power plant disaster or a nuclear blast is slim. Let's look now into the biologic disasters. Biological weapons are generally divided into either infectious agents or toxic agents. They are classified according to their risk to national security. There are 3 high-priority agents. Those are anthrax, botulism, and smallpox, as they are stable and simple to mass produce, easy to deliver to large populations, and are associated with high mortality and public fear. A biologic disaster should be suspected when there is a high outbreak of similar symptoms among previously healthy population, an increased number of sick people seeking health care, an atypical incidence of illness for the time of year and geographic location, a cluster of sick people from a shared location, unusual mortality rates among people following a brief illness, or unexplained death or illnesses among domestic and wild animals. We'll get a little bit more in detail. Anthrax is a spore-forming bacterium known as Bacillus anthracis. Anthrax is fairly easy to promulgate because it is a spore form, it is inactive, and causes disease only when inhaled, ingested, or introduced into non-intact skin. Out of all those routes, skin infection is the least deadly form and the only one that may be transmitted by direct contact. It is characterized by painless lesions, usually on the head or hands and arms, that develop into black-centered blisters that eventually will ulcerate. The standard precautions, measures for reducing the risk of transmitting pathogens, are usually sufficient when caring for clients infected with anthrax. Inhaled anthrax is the most deadly, on the other hand, and anthrax is treated fairly successfully with antibiotic therapy. The preferred antibiotic is ciprofloxacin, Cipro, or levofloxacin, Levaquin, both of which are fluoroquinolones. The treatment lasts for 4 weeks or longer for an inhalant infection. A vaccine has been developed to prevent infection with anthrax, but currently only military personnel and at-risk civilians are being targeted as recipients. Question number 1. You are a nurse who has to care for a victim of anthrax. The assessment findings of the infectious process associated with anthrax include, and the options are: A. Painless lesion with black-centered blister. B. Rash that begins on face and progresses to the arms. C. Diplopia and dystonia. D. Muscle twitching and tachycardia. Correct answer is A, a painless lesion with black-centered blister. The skin infection represents the least deadly form and the only one that can be transmitted by direct contact, will be characterized by a painless lesion, usually on the head, hands, or arms, that will develop into black-centered blisters that eventually will ulcerate. Botulism. Botulinum neurotoxin poses a major bioweapon threat because of its extreme potency and lethality. It's easy of production, transport, and misuse, and there is a need for a prolonged intensive care among those affected. A single gram of crystalline toxin, eventually dispersed and inhaled, can kill more than 1 million people. Smallpox. There is no immediate direct threat of a bioterrorist attack using smallpox, according to the Center for Disease Control and Prevention, CDC. No bioterrorist attack using smallpox has happened in modern times. Throughout history, though, some people have used smallpox to their advantage by deliberately infecting their enemies with the disease. The US government has proactively stockpiled sufficient smallpox vaccine to administer to everyone in the country if necessary. It may take up to 12 hours for the vaccine to arrive at any needed destination, however, which could be problematic in the event of a wide-scale attack. The smallpox vaccine is effective in preventing infection or rendering the illness less severe if administered within 3 days of exposure to the virus. However, in most cases, a person may be unaware of having been exposed. The vaccine is useless for a person who is already symptomatic. The biggest problem is that smallpox may be mistaken for chickenpox or varicella, although the outbreak and progression of the rash are opposite in these illnesses. So please remember, the rash associated with smallpox begins on the face and progresses to the extremities, including the palms and soles, with few lesions on the trunk. The rash of chickenpox begins heavily on the trunk and spreads lightly to the face and extremities, but tends to be missing or sparse on the palms and the soles. Smallpox lesions are generally all in the same stage of development, but successive crops of chickenpox macules and papules appear every few days. Smallpox has no specific treatment. Supportive measures such as fluid therapy, antipyretics, and antibiotics for secondary bacterial infection will reduce symptoms and will help prevent death. We'll discuss now chemical disasters. Chemical disasters result from the release of toxic man-made substances with a potential for causing mass casualties. Release of chemical agents among a population may occur either through an industrial accident or during transportation. Terrorists also can use chemical agents as weapons. Examples of extremely toxic chemicals include nerve agents, cyanide, respiratory toxins, and blistering agents. Detecting a chemical accident or attack is difficult because most chemical agents are liquids that vaporize quickly with either no odors or odors they may be attributed to other substances, as for example, garlic or onion. Some indications of a chemical release will include numerous dead animals such as birds, domestic pets, fish, or insects in a confined area. Dead or dying vegetation, sick, dying, and dead humans, especially indoors or downwind, unexplained odor atypical for the location, fog-like or low-lying cloud in the atmosphere, and abandoned devices that could be used for spraying chemicals. We'll discuss a few of the agents now. Nerve agents, the most common, the most toxic of all chemical agents, are very potent organophosphate compounds that will cause a fatal consequence by inhibiting acetylcholinesterase. Acetylcholinesterase is an enzyme that inactivates acetylcholine, a neurotransmitter, at the parasympathetic or cholinergic nerve system. Consequently, in cases of attack with nerve agents, the functions of the parasympathetic nervous system will be active without any potential for disinhibition. Three drugs are given to manage the effects of nerve agent toxicity, and those are atropine sulfate, which counteracts excess acetylcholine at the muscarinic sites, pralidoxime chloride, 2-PAM, which reactivates acetylcholinesterase, and diazepam or Valium to control any possible seizures. Cyanide is a solid salt or a volatile liquid chemical that causes death in minutes. It is used currently in gas chamber to execute prisoners. The Nazis used cyanide, known as Zyklon B, to exterminate Jews in gas chambers of concentration camps during World War II. The mechanism of cyanide's action is the inhibition of an enzyme cytochrome oxidase, needed for oxygen metabolism and cellular energy. The gas that forms with release of cyanide is colorless and may have a faint odor of bitter almonds. Inhalation, especially in an enclosed space, is the most deadly type of poisoning. Cyanide also can be ingested by eating food laced with it or in accidental poisoning when consuming various industrial chemicals that break down into cyanide-containing byproducts. An example is the compound used to remove artificial fingernails. Cyanide can also be absorbed through the skin. Nurses and other healthcare providers must wear protective garments and respiratory masks if the victim's clothing contains cyanide. Contaminated clothing is removed and placed in a sealed container while and during the resuscitation procedures. Respiratory toxins are chemical agents that primarily cause pulmonary edema when inhaled. Two common examples are chlorine and phosphogen. Those are liquids that become gases when released in the atmosphere. When vaporized, the gas settles and remains close to ground level for some time. Chlorine is used in households and commercially as a cleaning agent. It is effective in reducing the growth of microorganisms in water and pools. Phosgene has multiple industrial uses and helps producing polyurethane, insecticides, and solvents. Phosgene is a byproduct when freon, a gas used in refrigerators and air conditioners, burns. Both chemicals are used widely and therefore available for legitimate or possible terrorist purposes. Exposure to these respiratory toxins lead to tearing, coughing, bronchospasm, and laryngospasms with, following to that, air obstruction from localized swelling. Phosgene actually breaks down alveolar tissue. The consequences of exposure to chlorine or phosgene are related to the amount, route, and length of the chemical exposure. Death occurs as fluid infiltrates the pulmonary air spaces and terminal bronchioles, interfering with gas exchange. Following recovery from an acute event, victims may develop chronic bronchitis and emphysema. Blistering agents. Blistering agents are also known as vesicants and are chemicals that damage exposed skin and mucous membranes on contact. If inhaled, blistering agents also can damage respiratory tissues. Two examples of vesicants that have been used in chemical warfare include sulfur mustard, referred to as mustard gas during World War I, and mucicide, which was developed during World War I but never used. In addition to being a contactant, vesicants can penetrate fabric. When in contact with skin, these chemicals combine with perspiration to form a solution that will penetrate the skin and becomes anchored to dermal cells, forming blisters via an enzymatic protein digestion. The impaired skin creates the potential for infection. Inhalation of the vesicant is almost sure to cause death within 24 hours from airway obstruction with blisters within the respiratory passages. Some chemicals enter the circulation and potentially can affect major internal organs. For example, vesicants can damage the DNA of rapidly growing cells, which may explain why nitrogen mustard continues to be a chemotherapeutic agent for cancer. Let's continue with the blistering agents. So, care for the skin lesions is similar to burn wound management. The damaged skin may take several months to heal and longer if the wound becomes infected. Breathing is supported with mechanical ventilation. Blood transfusion or administration of colony-stimulating factors such as erythropoietin, like epogen or Procrit, and filgrastim, which you know as Neupogen, may be necessary if bone marrow function becomes suppressed. We'll discuss now the phases of disaster management. Emergency managers think of disasters as recurring events with 4 phases: mitigation, preparedness, response, and recovery. We'll describe each of them. During the mitigation, in this phase, will be included actions taken to prevent or reduce the cause, the impact, and the consequences of the disaster. In the preparedness, this phase will include planning, training, and educational activities for events that cannot be mitigated. For example, developing disaster preparedness plans for what to do, where to go, or who to call for help in a disaster. Exercising planned through drills, tabletop exercise, and full-scale exercises. The response. This phase occurs in the immediate aftermath of a disaster. During the response phase, businesses and other operations do not function normally. Personal safety and well-being in an emergency and the duration of the response phase depends on the level of preparedness. During the recovery, restoration efforts are happening concurrently with regular operations and activities. The recovery period from a disaster can be sometimes prolonged. So let's look now into what is the role of a nurse or nursing as a profession during a disaster. Nurses actually serve a critical role in emergency preparedness at the local, state, and national levels through planning, community and consumer education, and direct care provided during disasters. During an actual disaster, the first nursing action involves assessing as many victims as possible at the scene of the disaster to manage time efficiently and to avoid overwhelming valuable resources. Following a head-to-toe examination, nurses assign one of 4 categories in the standard triage system to prioritize victims' needs for treatment. And those are immediate, delayed, minimal, and expectant. Ideally, victims are tagged after assessing them to prevent duplication of assessments by another nurse or emergency worker. Although seemingly counterintuitive, nurses must adapt to the futility of trying to save casualties who are in imminent danger of dying. When supplies, equipment, and personnel are limited, nurses must be creative in implementing alternatives. They are often called upon to utilize and supervise volunteers as well. Question number 2. A nurse manager is educating the unit staff on the indications of a chemical release. The indications of chemical terrorism includes which of the following? And the options are A. Dying vegetation. B. Numerous dead animals such as domestic pets. C. Vapor-like substance in the atmosphere. Or D. Unexplained odor for the location. And E. All of the above. The correct answer is E. All of the above. All of the conditions listed could indicate chemical terrorism. Chemical attacks can be more difficult to detect because the agent used may vaporize quickly. What will be the nursing process for the client in a disaster situation? In a disaster situation, we can have the following nursing diagnosis: severe hypoxia, impaired skin integrity, risk for infection, or ineffective coping. In terms of intervention, those will include to provide comfort and emotional support, to administer first aid to victims in immediate category by performing CPR, covering wounds, control bleeding and splintering fractures, and delegate the care of those with minimal health needs to volunteers with first aid skills. Question number 3. A client is exposed to a thermal burn and is at risk for impaired skin integrity. The nursing intervention related to the care of this client will include A. Applying a semi-occlusive dressing over the wound. B. Immunizing against smallpox or administer vaccine immunoglobulin. C. Having victims shower and change clothes. Or D. Restricting public access to clients who are nauseated. The correct answer is A, applying a semi-occlusive dressing over the wound. The rationale is by cleaning the wound using standard precautions, a moist wound will increase the rate of epithelialization.